Welcome to the Medical Marijuana and Wellness webinar series. Tonight's topic is improving sleep with medical marijuana. And I'd like to welcome a couple of folks that are going to help me with tonight's webinar. First of all, I'd like to introduce Forrest Haag, who's with Surterra Wellness. Forrest, welcome, and tell us a little bit about yourself.
Hi, Mark. Thanks. We're excited to be here again tonight talking about sleep. It's a problem that a lot of us face with. I know that I do myself, whether it's falling asleep or staying asleep or the million reasons that can contribute to either one of those. But with me tonight, we also have one of my favorite store managers from our Orlando location, Rosa. And so I'll let her introduce herself.
Hi there, I'm Rosa. So I have been in the medical field for about 5 years now, and personally also suffer from some sleep issues. So I'm really excited to be able to assist and give some people some extra knowledge about my favorite plant.
Great. Well, listen, thank you very much for joining me. I know that sleep is something that a number of people wrestle with, and the question is, can medical marijuana help? And I believe it can, but rather than just throwing that theory out, we put together a video with Dr. Greg Holt from the Texas Sleep Society. Actually, he's from the National Sleep Society. And we'll play that, and then we'll answer your questions. I should mention to everybody that if you look at the bottom of your screen, you'll see a little Q&A button. Please feel free to ask questions. We'll be more than happy to answer those at the end of the webinar. And naturally, if you submitted a question ahead of time, we'll answer those as well. And I do want to mention this video is made for information purposes. If you have any medical issues or need medical advice, please consult your doctor. So with that being said, let's take a look at sleep. Welcome to Medical Marijuana and Wellness. Today's topic is improving sleep with medical marijuana, and I'm joined by Dr. Greg Holt. Dr. Holt, welcome.
Thank you, sir.
Tell us a little bit about yourself.
I was a PhD from University of Florida College of Medicine in physiology, and I'm a clinical sleep specialist from the American Academy of Sleep Medicine, and currently the president of the Texas Society of Sleep Professionals, and I work with ALS patients with mechanical ventilation right now.
That's great. So you have a little experience with sleep.
Absolutely.
And working with patients. I should point out that this presentation is for information purposes only. Naturally, if you're going to seek any medical advice, please consult your physician. I also want to mention that Dr. Holt and I have just finished doing a Understanding and Optimizing Sleep video, which you can find in this channel, which you might find very interesting. It's something that delves deeper into the subject of sleep and how it can help you and how you can improve your sleep. So, Dr. Holt, the duration and the quality of sleep really is related to your health.
Yes, it is. When you look at the far left, recommended sleep, you can see that you need more sleep the younger you are. And that's true. The worst part about it is everybody in the middle that's getting a reduced amount of sleep these days because of either the video gaming that's going on, social interaction, social media. They are shortening their sleep because of a lot of other things that seem to be going on in their life. And that's something that has to be stressed through good parenting about shutting it down and trying to get everybody to get the right amount of sleep.
Yeah, I think that's really important. You mentioned especially younger folks, they're like sponges, but I think also for seniors, it's important to get that 7 to 9 hours of sleep as well.
Yeah, when you get older, of course, more pathologies happen. And if they influence your sleep and the sleep staging, older folks still need that deep stages of sleep for restorative sleep. They need good REM sleep for psychological health. And they can't break up their sleep to like 1 hour here and there and start sleeping off and on all day. You know that there's something underlying going on. So getting that sleep all into one big pile is important. A short nap, as long as it doesn't affect your sleep onset later that night, is always okay. You know, and the younger people, the babies, could get 2 or 3 naps a day, and that's good. That's normal. That's fine. But in general, to have all of your sleep put together, not trying to like catch up on sleep on the weekends, reduced amount of sleep during the week, all of those things are bad for your health.
Mm-hmm. That's really interesting. And really, when you look at your immune system, your neurons really help control sleep.
You know, they do. There's like certain groups of cells inside the brain that are situated to like help with wake state and situated to help with sleep state. So it's like being on a seesaw where you have a bigger hand on one side of the seesaw and you will be in wake state, neurons that are in like the frontal cortex. And then some of the deeper sites could be for sleep state. So they all interact together. One suppresses the other to make sure that you're in a wake state, to make sure you're in a sleep state. And when there's any kind of disruption on those two, that's where you can have sleep waking disorders like narcolepsy, where you can fall asleep in an instant with things that surprise you, and then you're out in a conscious, but it appears like you're in a sleep state. So it's a very interesting sleeping disorder, but definitely important.
Yeah, and your immune system uses sleep to be able to really refresh and strengthen itself. You mentioned there's cytokines also that come into play here.
Yeah, cell active substances that are running around inside the body. You know, cytokines are important for everything we do to like signal some kind of like a foreign invader is coming into the body. And those cytokines sort of signal to the body what's going on with each other. So everything that goes on inside the body can be affected by being reset, refreshed, and ready to respond to things like infection.
Right. Now, when you have some sort of a mental or physical disorder, that can affect your sleep.
You know, it's hard to tell sometimes which one comes first when you're talking about sleeping disorders and some of these other disorders like you have listed here. Sometimes the sleeping disorder can precede things like anxiety and depressive states. And sometimes you end up with like different conditions that can end up having problems. So when you look at even cancer with extreme intractable pain, that shows up on a sleep as first shows up as arousals with this alpha intrusion that can cause fatigue during the day, but more and more of that alpha intrusion and less good quality sleep, you can become sleepy during the day.
Sure. So when you look at why we sleep, one of the reasons is basically to survive.
Oh yeah. You know, there's something called fatal familial insomnia where you could be awake for about 3 months and then you'll die. So definitely found out that, you know, that you need to have sleep to survive, but the brain, when it's in an active wake state, it's discharging a lot. Different neurons are firing things to keep the body moving, keep the body thinking, to do all these kind of processes and nice rapid discharging, but that can't keep up forever. So it's got to reset itself. So when it goes into the sleep state, the neurons are resetting themselves, taking up some of that neurotransmitter kind of stuff they release during the awake state and getting ready for the next awake state. So critically important to have sleep combined with awake state.
That's what we're pointing out here. It's kind of like rebooting the computer. That's what your system is doing.
It's absolutely what you're doing.
It also helps us grow and heal.
Yeah, we look at circadian phasing. We can reference circadian phasing to even the circadian phasing of hormone release, like growth hormones are released in the first third of the night in deep sleep. So when you have deep sleep, you get growth hormone release, and it helps you to like grow normally like you're supposed to. So without good sleep, sometimes, you know, even growth could be stunted.
Sure. Now, when we take a look at sleep, sleep has more of a dynamic state than it's something that you go through phases.
Yeah, well, that's one of the common misconceptions about sleep is that once you're asleep, it's just there. You know, the things aren't happening inside the body. And that's not true because you move through different brainwave patterns that are either a deeper pattern or a lighter pattern. Like REM sleep is a lighter pattern where the EEG almost resembles the awake state. And in deep sleep, you can very much tell that, you know, it's hard to arouse people from a deep sleep. So there's a lot of things happening there too. And you can see things like pain on the EEG pattern where you get this fast 10 cycle per second cycling called alpha delta sleep or alpha intrusion. You can actually see chronic pain on the EEG and know that they need to treat that to help treat their wake state functioning.
And you mentioned it, and it's been mentioned that pain and anxiety are really the main reasons why people have trouble sleeping.
Yeah, you know, they have trouble getting to sleep, and then if they wake up, they have wake after sleep onset insomnia. You know, there are problems all over the place. Anxiety, psychological problems are something that, you know, you need to deal with during the wake state so that you will sleep a little bit better.
Right. And so when you define what sleep really is, it's you had a good definition of that. Why don't you give me that one more time?
You know, when you're thinking of like sleep, remember that, you know, you have sleep, wake, and then you have loss of consciousness. And loss of consciousness is not the same as restorative sleep. So you have to look at the EEG waveform if you're trying to define sleep. So if you're awake and you have your eyes closed, you know you're not asleep. But somebody else looking at you is like, well, he's not moving, he must be asleep. And so you have to have that EEG component with it to tell that somebody's asleep and not faking it. You can't fake sleep once you have the EEG on somebody, but very different. So you have to, when we put somebody in the sleep lab, there's like 16 sets of electrodes on them, and we can really tell what's going on with you.
Yeah, that's interesting. So when you want to treat insomnia, it's interesting from my perspective that insomnia is really suffered by 64 million people here in the United States. If you have insomnia, you're not alone. And the interesting part also is that ladies are more susceptible to it, and it's also seniors are more susceptible to it. But Dr. Holt, how do you treat it?
Now, the first thing to do is to identify and think to yourself of why you're having trouble getting to sleep. If you took a 2-hour nap during the day, but you can't go to sleep, at your usual bedtime of 10 o'clock, you should be aware that a 2-hour nap, you're not going to go to sleep at your normal bedtime, but it'll be delayed by 1 or 2 hours. So that's an easy way to figure out. If you drank, the easiest patient I ever had at the sleep lab was like, what do you do before you go to sleep? She had problems with reflux and insomnia. She goes, I drink a quart of sweet iced tea. It's like, oh, really? Don't do that. And then she found out, she never had to come back. Everything worked out. She just called in the office and saying, I'm all right. So yeah. You look for any kind of pathology, underlying disorders, medications, behavioral issues. If you look at number 3 there under treating insomnia, cognitive behavioral therapy is a CBT. When you're looking at behavioral therapy, you try to fix what you might be doing wrong during the day to help you get to sleep better at night.
Sure. Interesting. Now, you also have an Epworth scale, which folks can get in this video down below. What you'll find is that you'll get a link to the Epworth scale. Tell me about that, because that's a good indicator, to at least a place to start to help you figure out how to get better sleep.
Yes, yeah, it's pretty much what we got. Sleep is like pain. You get a subjective interpretation of it. It's like, how much pain are you in, sir? It's like a 0 to 10. He was like, I'm a 7 today. It's like, okay, you're in a lot of pain, I see. But how do you really know? It's the same thing with sleep. How sleepy are you? Well, I'm so sleepy that I could fall asleep right away. And here we've got like a 0 to 23, I believe it is. It's like, if you're higher than 10, then we think that you got some excessive daytime sleepiness going on that we need to look at. But if you look at that list of things, and it says like stopping for a few minutes in traffic while driving, it's well, I don't drive, I don't have a car, I'll put 0 here. But you can see how some people would falsely lower their number and look like they're not sleepy. So, but this is what we got for some general things of what people do. So if you know that you doze off at a red light, if you've ever driven off the road to sleep, those are the people we see in the clinics like faster than anybody else.
Sure. And again, you'll have a link to this particular to this particular scale to be able to click on that link and be able to download this particular chart. So let's talk about cannabis. Let's talk about medical marijuana and see how it really helps. What's interesting is there's been a number of studies done on sleep, and it really has the endocannabinoid system has a major role with the circadian rhythms that go on within the body, that whole wake and sleep cycle. They have found that the ECS, the endocannabinoid system, also supports your sleep function, and really causes a lot of your body to make itself better, to heal itself, and be able to control itself. And THC also has some sedative properties with respect to helping you sleep. Dr. Holt, you had mentioned something about cannabis being a very effective method for being able to address sleep.
Yes, I think it's got like a lot of good properties that haven't been well studied, because like we were talking about at first, it's because it's still a Schedule I drug in the United States, and it makes it frightening to study something that could actually put people in jail. So that's been like a big inhibition to this entire thing. But with it opening up recreationally and medicinally, we're finding out more. It's like, well, whatever I took, the other night put me to sleep right away. So anecdotal evidence is starting to turn into like sleep studies to find out that it does reduce sleep onset latency. It puts you to sleep faster, so to speak.
Yeah,
So
and I should point out that a lot of sleep studies are being done outside of the United States where it is legal, in places like Israel, Canada, England, Germany, Spain. We're finding that there is a lot of sleep research going on with respect to medical cannabis. Unfortunately, we're just behind the eight ball here in the United States. We really got to catch up to the world and get our legislation correct.
When you're looking at the endocannabinoid system, like 35 years ago, when I had the first 2 years of medical school at UF, we didn't talk about this. That wasn't even something to look at. And it wasn't something that we said that there are CBD receptors inside the body. This wasn't even mentioned. And I don't know that it's mentioned at all these days either. And some of the claims that are made about medical marijuana may or may not be true, that I'm not sure. I haven't read any studies like reducing sleep apnea events. I can't say that it does, except I would say that because the molecule resembles tricyclic amines like protriptyline or Vivactyl, that it reduces REM sleep. And if you have REM-dependent sleep apnea, or more apnea events may be demonstrated, if you suppress REM, you suppress REM apnea, surely it could be true. Some people use things like protriptyline off-label to suppress REM sleep, to suppress REM sleep apnea. And I don't think it's right, because, you're using a medication to stop sleep apnea, but that's a true statement. But, the application of it to me isn't done the right way. I wouldn't smoke marijuana to stop sleep apnea, is what I'm trying to say.
That's good. That's a good point. It is important, though, to put both THC and CBD together if you really want to address sleep. What's also found is, and goes one of those anecdotal studies, that in Colorado, when recreational cannabis was approved, it was found that sleep aids sales fell over 200%. People not only started using, but they recognized the effectiveness of using cannabis for sleep.
Yeah, absolutely right. And I think that medical marijuana for sleep onset is probably a lot safer than a lot of the medications that are used. You can have some liver issues associated with things like Benadryl long-term, certainly things like alcohol, for an acute form of insomnia. I think medical marijuana has a better kind of efficacious effect than some of the things that you saw over the counter. And a lot of those over-the-counter medicines are Benadryl-based diphenhydramine, so it's not a good idea long-term for sure. In fact, to me, any kind of medication long-term for chronic insomnia means that you haven't looked into it enough to find out what you need to try to do. Of course, there are people that are on chronic medications. I'm not saying it's horrible. I'm just saying that if you haven't looked at everything to improve your sleep behaviorally and any kind of underlying medical condition, then you're not doing it the right way.
Sure. It's really interesting. And also, again, I'm going back to the fact that there are studies that have been done that really relate the endocannabinoid system directly to sleep. And it helps you and the endocannabinoid system is something that helps you control your mood, your appetite, your circadian rhythms. Circadian rhythms are very important.
Yes, yeah, circadian phasing, critical. You have to be for the right sleep onset. You have to be on the downslope of the circadian phase, and you have to have enough sleep pressure built up that you can see in that other video to fall asleep naturally. So to be able to fall asleep naturally, those two things, sleep pressure and circadian phasing, have to be lined up to fall asleep naturally. And a medication like medical marijuana, done the right way with the right combination for you as an individual, will help you push you over that edge to fall asleep.
And CBD has been known to decrease both anxiety and pain. And what's interesting is the American Sleep Association found out that consuming medical cannabis gives you significant improvements in insomnia. And so, again, it's been studied both anecdotally as well as in the labs, and you'll find that it is an effective mechanism for being able to address sleep. Now, one of the things people ask me all the time is, why is cannabis such a big deal? We all know that we all have a nervous system, and we know that if we hurt our finger, bang our knee, something happens in our body, our our nervous system communicates that to our brain, says, Houston, we have a problem, and then Houston recognizes that. That we all knew it was in existence. But as you mentioned, Greg, what they have just found when they started studying medical cannabis, especially the last, let's say the last couple decades, is they found that we also have an endocannabinoid system, which helps your body manage itself and stay in what they call homeostasis and stay in balance. This is the part of your body that manages pain, anxiety, memory, inflammation, a whole bunch of things like appetite. ECS is really, when you say, Houston, we have a problem, where did Houston hand the problem to? It handed it to the endocannabinoid system. Now, this is fairly new. Is that correct? As far as knowledge to the medical profession.
It's being studied more. I mean, it used to be underground studies looking at, they were calling it anandamide in like 1980s research and early in that, so they could hide the fact that it was like cannabis related research. But now when they looked at receptors inside tissues of the body, they found collections of receptors for the endocannabinoid system. And when they found these collections of receptors in the body, well, they must be doing something. They must be communicating somehow. And they probably do interact with the different cytokines inside the body and with the nervous system to either tune up how fast the communication signals, the action potentials go down and move back towards the brain. So there's probably a lot of interaction with what can go on in the endocannabinoid system.
And this is very important. This knowledge is very important to help people, especially when you're addressing sleep. The other thing I want to point out is that when you look at CBD, they talk about the CB1 and CB2 receptors. CBD also affects a lot of other receptors. It's like a super vitamin for your body, some of which have to do with, you mentioned sleep, your blood pressure, and that type of thing.
You can see a lot of things in here like this COX-2 is cyclooxygenase, cyclooxygenase inhibitors when you're talking about aspirin, things like that, with like reducing inflammation, reducing pain. So if you see that CBDA has an effect on the COX-2 receptors, I think you're talking directly about some kind of like pain reduction that's in there. Right. The 5-HT is serotonin like receptors down at the bottom. Mm-hmm. You're looking at all kinds of things in there that can help control some of the release and uptake of serotonin. So there's a lot of things in there too. If it has an effect on these types of receptors, then it has a certain physiologic effect that needs to be studied so we can figure out exactly which one is doing what.
Sure. I mean, when we say that we think medical marijuana can help with sleep, we're beginning to find through studies, we're beginning to understand exactly why. And I think that's very, very important. Now, I should point out, when I got involved in cannabis 10 years ago, we heard about indicas and sativa. Indica was relaxing, sativa was more energizing. And that really is almost all gone away because a lot of the production of the product today is not only looking at the kind of strains that we're using, but also what they call the terpenes. And we'll talk about terpenes in a minute. But terpenes provide the medical efficacy of medical cannabis. And what's going on today is a lot of the dispensaries, a lot of the producers are matching the terpene profiles and strains to a particular condition. And when they do that, they create what they call cultivars or chemotypes that we're being able to breed or being able to put together products that address things like sleep. For example, there's a company, Surterra Wellness, that has a product called Dream. It's made specifically to help people sleep at night. So we know that in the area of medical cannabis, there are processes going on. There are production going on to really address various conditions. Again, sleep is one of them. And Greg, you mentioned earlier, I think it's important to point out, it's important to get your dosing correct. Getting the right dosing, your body will tell you when you are at the right therapeutic level. I'm not going to jump in too much on dosing because we have a webinar on that. Please go to our YouTube channel and watch that one. It'll help you figure out your sweet spot. But that is really critical to effectively use medical cannabis. Now, a lot of people ask, are terpenes important? And the answer is yes. This is where the medical properties, this is where the medical benefits of cannabis come into play. And I do want to point out, these are the main terpenes. There are right now we know that there are over 150 different terpenes in cannabis. We know there are 100 of them being studied, but this is kind of the top list of ones that really affect sleep. We know that caryophyllene, myrcene, nericol, we know that linalool, pinene, terpenolone, and limonene all help with sleep. And so if you're looking at using medical cannabis, when you're talking to the dispensary, ask if they have this terpene profile. If they do, the product you're buying will in fact help you with sleep. If in fact they don't have this terpene profile, or some of these terpenes in there may not be as effective for sleep as what you'd really, really, really like. Now, I also want to point out that there are also, let me back up a little bit. There's a number of what they call cultivars. I mentioned earlier, a lot of dispensaries are making products to address sleep. And you can see there's a number of what they call the strains that you'll hear about, the Granddaddy Purples, the Northern Lights, the OG Kushes, the Blueberries, Purple Kushes, that actually look at really helping you with sleep. And that really comes from, if you look at the terpene profiles, it goes back to having the right terpenes that are in there. You've seen this with some of your patients, is that correct?
Well, not in the sleep lab, but I love this slide because to me, this is like it started out because, you know, the more people that are using it and the more people that are familiar with terpenes and terpene profiles give feedback. And so you can look at it all like anecdotal evidence, but if you have 400,000 people that say this combination of terpenes makes me sleepy and relaxed, you're going, all right, we got something with that many guys saying the same thing. And that's where, you know, everything in here needs to be like added to where you're looking in research to say that, okay, I know where the receptors are. I know what's being activated and not being activated. And yes, it is related to a reduced sleep onset latency. And then it makes it a relatively safe medication like medical marijuana for sleep more effective and backed up by science. And I think that's where everybody is pushing for now. It's like, all right, you know, we've got a lot of points highlighted from a lot of people that say what it does. So let's make sure that it does exactly what we believe it does based on the terpenes. So
and I agree with you. It's time here in the United States to start doing more research in the medical cannabis and really trying to help the millions of people that can be helped by this particular form of this alternative or this option people have.
Yes.
So let's talk. I'm going to go back for one. I went through that very quickly. We hear about one of the cannabinoids called CBN, and CBN is really kind of interesting because it's really known to help with sleep. And that's because it is really high in a lot of the terpenes, like the linolols, the myrcenes, and humulines. The nice part about CBN is it isn't really it's not intoxicating like CBD, or excuse me, like THC. It's much safer. It's much easier to use. And if you look at it, you can actually find CBN in a lot of the medical cannabis products that you're looking for. So again, when you talk to the dispensary, ask them about the the strain profile, but also so you try to find out if the right cannabinoids, if CBN is one of the cannabinoids that's in the product that you're taking a look at. So it's something to pay attention to.
Excellent. Yes.
Routes of administration are also important. One of the nice things about cannabis is it's not like you take 2 pills and I'll see you in the morning. There's a number of different ways of using it. You can take it. I find the most easiest way to use it is sublingual drops, where you just drop it underneath your tongue. It takes about 10 to 20 minutes to work, and it'll work between 4 to 6 hours. And that goes the same for sprays. You can actually have a spray that goes on the inside of your mouth and is absorbed by the blood vessels. Greg, you've seen that as a way of providing medicine. Providing it sublingually is really important.
Oh yeah, you know, it avoids what's called the first pass effect. Like if you look at nitroglycerin, sublingual nitro for angina or chest pain, you know, cardiac related chest pain, you put it underneath the tongue so it doesn't go through the liver and being broken down before it gets to the coronary arteries surrounding the heart. And that's what you're trying to target. So if you're trying to relax the coronary arteries to get more blood flow to the heart to relieve that chest pain, swallowing that pill is not going to work, you know, for what you need. But so you really look at some of these things on how fast they work and the duration of action for sure.
Now, I know that when people are starting to use medical cannabis, or people are using medical cannabis, the key is to be able to find your therapeutic level of relief. More is not necessarily better, but you'll be able to find that as you're using cannabis, you take, for example, sublingual drops are the best way to start. Taking just that first line on the eyedropper, 0.125 milliliters. You may not feel anything, go up to 0.5. By increasing that, you'll feel better. your body will tell you exactly how it's working. And when you take a little bit too much, you feel anxiety. You won't feel as well. That's when you back down and you found your therapeutic level of relief. Sublingual drops are really the best way to do that. It's the easiest way to do that.
And that was a problem with the original medications like Marinol, which has 5,000 times the affinity for the receptors than anything else that's out there that, you know, is natural, like a natural flower. And people say that it just like incapacitates me. I hate it, won't do it. You know, they'd rather smoke 1 or 2 puffs off of something and get it titrate to the desired effect and not just blast their entire body. So, you know, proper dosing, figuring out what works for you, trying not to overdo it and build yourself up to like getting that therapeutic range is what you're looking for.
And, you know, and you mentioned inhalation. Let's tackle that one for a second. A lot of people will say, well, gee, I'll just smoke a joint and I'll feel a lot better. What's interesting is terpenes, which we talked about earlier, are extremely sensitive to temperature. So if you take that 500-degree flame and you light that blunt, you light that joint, what you're doing is you're burning off about half of the cannabinoids. You're burning off all the terpenes, most of the flavonoids. So you're reducing the efficacy of that particular joint or that blunt down about 50 to 60%. That's the bad news.
You're looking, definitely breaking open those the molecular structure of a lot of what's going on for sure. But everybody knows there is some effect there. So when you switch from like one dosage of one type of delivery method to another dosage of a different type of delivery method, they will not be the same. True, very true.
Right, and that's why using concentrates where you drop cannabis into a vape pen, you can control the temperature. And you'll find in these pens, you'll find a low, medium, and high setting. And so if you set it to, like, for example, low, you'll be getting a lot of the terpenes that are needed for or really help with sleep. That's why when we take inhalation, I really look at vape pens and concentrate pens as the way to go. And that's why they've really been developed. You also want to mention that topicals are important. I know I have a herniated disc in my neck. I find that putting on a topical works almost immediately, and I get 1 to 2 hours of relief. And then also one of the famous ones is oral edibles, the gummies, the chocolates, capsules. They take between an hour or to 2 hours potentially to work. They'll last a long time. So, for example, in the evenings, if you want to get sleep during the night, I take some chocolate just before bed, and it helps me sleep through the night. But it does take a couple hours to work. Greg, you got to be really careful of edibles because of the fact it has to metabolize in the system.
Yeah, you know, after you eat it, you can't take it back generally, you know, so you really have to be careful with the dosing and wait out the entire time to see how long it lasts, how long it takes you for that dose, and try to work your way around that, you know. And always when you're new on any kind of medication, you know, try not to be active doing something that could end up like a, you know, a motor vehicle accident or something like that.
There you go. Now, we have an old saying that about the time you think that an oral product like a gummy or a lozenge or a brownie doesn't work is about the time it starts working. So just be patient. Just be cool when you're able to do that. There are famous stories about that go on out there. So routes of administration are very, very important. So what's the bottom line, Greg? I think it's interesting when you look at medical cannabis. You know, sleep is important for in both duration and quality for your health.
Well, everybody's got to know that there is no substitute for sleep. And so when you look at those tables of like how much sleep for somebody my age is important, you know, the way they figured that out for an adult at 8 hours a night, it's like if you look at people that are sleeping less than 4 hours a night and the people sleeping more than 12 hours a night, for whatever reason, are dying off faster than the guys at 8 hours a night. So that's why they came up with hey, we should recommend that you get 8 hours a night. You could be a short sleeper, you could be a long sleeper, and that's still healthy and that's still okay for you. But just keep in mind, less than 4 and more than 12 is not good. And you should look into what could be going on in your system, especially if you don't feel right during the day.
Right. And I do want to point out that there are studies being done on medical marijuana and sleep. They're not necessarily being done here in the United States. Most of the studies in the United States are anecdotal, meaning they just are taking patients that they find out there and recording what's going on. But a lot of those studies are being done, like I mentioned, in Israel, in Canada, in Great Britain, in Germany, in Spain. The amount of studies are there, and I think that's important. I know a lot of politicians will say we need to get more research, and we do. There's no question. We also need to remove the barriers to that particular research.
It does work, but you know, always keep in mind to be aware of your circadian cycling, downside of the circadian phase, with enough sleep pressure to built up during the day to fall asleep naturally. But you know, medical marijuana will help push you over the edge, and it's just sometimes it's a better way for an acute form of insomnia.
That's a good point, and it is safe. There's no reported deaths, overdose or deaths from cannabis, both either recreationally or medically. I do want to point out, as I mentioned earlier, we did do a understanding and optimizing sleep video. You can find it here on our YouTube channel. So please tune in, and if you want to learn more about sleep, please check that out. Greg, any final thoughts?
Well, I just want to make sure that everybody understands that too much of anything, including marijuana, medical marijuana, recreational or medicinal, especially for insomnia, is to take a look to see if there's something that you can straighten out behaviorally. And you could look at sleep hygiene online and find a lot of things that you could do better. And if there is some kind of pathology going on, sleep apnea, undiagnosed, untreated, chronic pain, you know, sometimes you have to look at that and treat the underlying condition to sleep better. Medical marijuana for insomnia has its place. Insomnia is the largest kind of sleep pathology, like anywhere, especially in Western countries. So getting better sleep without any kind of medication is something that we should all work towards. But medical marijuana is safe and safe to use on occasion.
And one of the steps to getting there is really using medical marijuana as a safe way of heading in that particular direction.
Yes,
Greg?
it relieves anxiety and it could help with a lot of different things. So I do believe that.
Greg, thank you very much for the assistance on this video. And I want to thank everybody for watching. Please feel free to check out our social media channels, the YouTube videos, to be able to get more information, not just about sleep, but other conditions. And then also check out our weekly medical marijuana aware videos. Every Wednesday, we put out a video on various conditions and how medical marijuana can help. So we look forward to you joining us, and thank you very much for watching this particular video. Welcome back. What we'd like to do is, there's been a lot of theory about sleep. We just went through a presentation. I think what I'd like to do right now is really talk about some specific products that you can pick up that will help you with sleep. And with that, Rosa, can you give us some background on some of the products and some of the processes that you're using at Surterra to address sleep?
Absolutely. So I picked some of my favorites for this list here. And the top of it, I actually have one of my absolute favorite products and probably what I start most people with when they have sleep issues. And that's our Calm products. Those are going to be a high CBD. It's a 12.5-to-1 ratio product. And it has a lot of myrcene in there. So I tend to find with the CBD kind of attaching to those CB2 receptors, which are throughout the body, and they do relax the body down a little bit more. I think that it really balances out the body and mind. So it helps people ease themselves into sleep without feeling overwhelmed with any psychoactivity or anything of that nature.
You know, I should point out my wife uses Calm. And I think it was important that when we did her dosing, we were working on it, we found her 1-to-1 ratio where she had her therapeutic level for THC. But by increasing the amount of CBD, in other words, going to a 2-to-1, a 3-to-1, a 4-to-1, and eventually to Calm, which is a 12-to-1, we ended up finding a product that worked very well for her.
Excellent. That makes me very happy.
Yeah, and it comes in not just tinctures. You also have concentrates and patches, right?
It does. So it comes in something we call our pure reserve oil. So that is going to be a distillate oil. It comes in a tincture oil, which is a really great place to start, like you said, because you can kind of get those teeny tiny dosings and then work your way up to a really great place. It comes in Theragels, which are a bovine capsule, and those kick in pretty quickly. So I enjoy those a lot because typically within 45 minutes they kick in, whereas a typical capsule, for me at least, kicks in about 2 hours. And then it comes in patches and lotions. So if you have any inflammatory issues, joints, like you mentioned, neck pain, I use it for my shoulder at night. And those, a great assortment of items for the Calm line.
Mm-hmm.
Then, I'm sorry.
Go ahead.
So my next one I put in there, I put Primal Fusion. And this guy, normally you don't see limonene as one of the top terpenes, but I have noticed with limonene, a lot of times it does get you to calm down and be in a better headspace. And back to, I have a lot of anxiety. So sometimes with sleep, I struggle to just get my brain to kind of shut down and get myself in a happy, healthy place. And I find that with the Primal Fusion, because of the limonene and that caryophyllene to kind of bring me down, get the all that anti-inflammatory properties in there and kind of get my body to relax, that linalool comes through and I'm always super sleepy afterwards. And it's such a lovely feeling. For that one,
it comes not only in flower, but you also have it in the kief and the rosin. I know that rosin is really that concentrate pen that we talked about when we talked about routes of administration.
Yes, definitely. Rosin's my preferred method. So that's actually how I'll use the Primal Fusion usually. And like you said, I try to use it at the lowest setting that I can. So that way I'm getting those delicious terpenes in there and it's just making that whole medicine feel so much better.
It's really interesting. When I first got a dry vape pen as well as the concentrates, and I was experimenting with the different levels of, let's just say the different levels of low, medium, high. It was amazing to me how much better the lower level, which is where you get a lot of the terpenes for sleep, they're most effective. When you set that lower level, it tasted better and it was more effective. And I know that's counterintuitive to a lot of people that say, we want to go faster, more, higher. Sometimes just being able to set the right temperature, that low temperature, is something that makes a big difference.
Yeah, definitely. I tell everybody, go low, go slow. And that's for everything, your dosing, your temperatures, everything.
Right. Just be cool. Just be cool. Right,
definitely. Going into the next two, they are heavy hitters. They're great sellers in store as well. We have the Skittles Cake Creamsicle. This guy comes in flower, rosin, and kief, and it's got that first terpene as the caryophyllene, which again, I love that anti-inflammatory properties in it. It really lets me unwind from a long day and just lets me melt into my bed, which is one of the best feelings at night after a long day. And Animalary does something very similar. So Animalary is heavy in myrcene in the beginning, and then it has the caryophyllene and linalool. And so I actually, when there's a combination of all of them, it's one of my favorite things. So if you put caryophyllene and linalool together, at least for me personally, it gives me all of that relaxation that I need. And then once you add in that myrcene, I'm in such a great place. I'm getting to sleep, especially with the added myrcene. Like I know I'm going to bed. My body is relaxed. My mind is relaxed. Everything's going to be great.
Well, you're pointing out something very important. It's really, if you look at the terpene profile of a lot of these, what you're really getting from these particular products is the result of the terpenes. And I know people like to talk about strains. It's kind of the vogue thing. But in reality, the terpenes are really what make the taste, the medical efficacy come out.
Absolutely. And I find with strains, I've had strains from different places where they do end up having slightly different terpene profiles. So I do always try to focus whenever I'm looking for my medicine at the terpene profile more than that name.
Yeah, that makes sense. There's an old saying that Jack Herrera is not Jack Herrera is not Jack Herrera. That's a strain of cannabis. If you go to different dispensaries, you will find different terpene profiles.
Absolutely. Especially with Jack, the classic.
Oh yeah, especially with Jack. So tell me about your gummies. Now you've talked about a lot about flower, but let's get down to the gummies, which some people enjoy.
Definitely. So the gels are some of my favorites right now. They're a new product that we have. And the pear and lemon are specifically indica, known for being sleepy and pain relieving. But something that I really enjoy about edibles that I actually tell all my patients to do is I find a lot of people have trouble both getting to sleep and staying asleep. So I tell them to layer their medicine. I'll tell them usually an hour or two before bed, start unwinding, get into your normal sleep routine, because that's so important to get you good sleep is starting that routine. And then usually use those pear or the lemon gels so that it's starting in the system. And by bedtime, it's going to start possibly kicking in. Maybe not yet, maybe an hour or two after you've already laid down, but then you can use something like a vaporizer or the rosin, and that'll get you straight to bed. Your edible kicks in as you're sleeping, and then you're coasting for a smooth 6 to 8 hours.
You pointed out something that's really important. It's what I call the regime. What is your regime? What is your coverage? I know in my particular case, I have herniated discs in my neck, and they're not going to go away.
Mhm.
And when I first started trying to address them, I was using a tincture drop, which was great. I take it at 10 or 11 o'clock at night, fall asleep, and then at 2 or 3 in the morning, I'd wake up in pain again. And that's because the tincture drops wore off. When you're using a gummy, an edible, or a capsule, they'll last anywhere from 4 to 10 hours. So they tend to really help you sleep through the night. They really give you that whole effective relief. In my case, I happen to use gummies. Excuse me, I happen to use chocolates. But I think this is important. This is where you talked about layering them. Pay attention to when you're going to need that particular product or what that coverage is. Let's put it that. How long do you want it to work? Because if you take something that's supposed to last 3 hours, you'll wake up at 3 or 4 in the morning and really have trouble getting back to sleep.
Absolutely. The good thing is we have our dream pens.
There you
So
go.
we have our dream products. And I tell a lot of people that if you do have trouble, and at first people are very scared of dosing, we start them super low and try to make sure that you're building up to your therapeutic dose so that you're not overwhelmed with your cannabis. But putting that dream pen, I say grab the vape pen, put it right on your nightstand. And then if you do wake up in the middle of the night, you can have that immediate effect and get some good sleep and be able to hold you over until you're ready to wake up.
Really is amazing to me how well Dream works.
Yes, Dream is so effective. It is such a heavy seller in store. It's also something I've been using for years now. Genuinely, I would say a game changer to sleep. I've tried a lot of things, and most in the traditional indica verbiage, it doesn't get me to sleep personally. But that Dream pen really knocked it out of the park the first time we tried it. I came before we launched it, and so when we launched that pen, I was so excited for all the patients that needed just a little more oomph in their sleep.
Right. And you should point out you have another product at Surterra that has a 1 to 9 ratio as well. And really the difference between the two products is the terpene profile.
100%, yeah. So with the Dream, you're going to be heavier in the myrcene and the linalool, and I believe the caryophyllene in the beginning. And then you have some limonene to kind of light up that system and get you all relaxed down. I noticed with the relief, you're just heavier in myrcene, heavier in caryophyllene, really focusing on that pain relief more than the sleep. For some, getting that pain relief taken care of does get them to sleep. Once you take care of the root cause, it gets you to bed. But the Dream kind of takes care of everything, in my opinion.
Yeah, and what I love what you're doing at Surterra is you're starting to put together some products that address medical conditions. We talked about that earlier. Those cultivars or chemotypes. This is where you're looking at, if I want to have somebody address sleep, here's a product for you. And I think probably, to be candid with you, in 10 years, we're going to walk into stores and see products labeled for sleep and for pain and that type of thing.
Absolutely, I agree. I think we'll move away from the plant verbiage and kind of focus more on that medicinal properties of it. That's one of the reasons I love our wellness line. That's what Dream is a part of. That line really does help you focus on finding that wellness, and then you can tie in all the rest of everything that you might need. And the dream comes in a couple different things. So for some people, the nice thing is that they can have that just, the vape pen ready to go, sitting on your bedside table, but you can also take that tincture oil when you fall asleep. So that way you're getting that longevity, kind of that 1-2 punch for sleeping. It also comes in a Theragel. So if you're not someone who enjoys the tincture oil taste or feel, we always have something else for you.
Sure. Well, this is kind of an interesting little quick summary. I guess what the bottom line is, if you're looking at addressing sleep and insomnia, please go to Surterra Wellness. You have some products that are specifically designed and can help with that.
Definitely.
Cool. So we have some questions. Let's kind of jump into the questions and see what we can do to address some of those. Now, we have some questions that were asked prior to our putting together this webinar, and then we have some that were submitted during the webinar. So let's start with the pre-submitted questions. And Rosa, Forrest, maybe you can help me a little bit. Is indica the only type that can help with sleep? Is there a hybrid or sativa that can also help? This is something, Rosa, that's right up your alley.
Yeah, definitely. So like I said, I think we're going to slowly start moving away from the plant makeup as kind of indicating whether it's going to be something relaxing or more energetic. I know plenty of people that actually use sativas for sleep. So it really does depend on the body and how the endocannabinoid system reacts to all those different terpenes. So I absolutely think that you could find anything that works. I know so many hybrids that actually work very well for me for getting to sleep, which is funny because you would think traditionally that those indicas are going to get you to sleep.
Sure.
So that said, I'd pay attention to the terpenes versus the indication of hybrid versus indica and sativa.
Yeah, totally agree. That's an excellent comment. I think that's what we're trying to have people understand. If you walk away from this webinar understanding just one thing, that's important. The terpene profile is where you should be headed. Now, the next question, which is being a severe asthmatic, I can't vape or smoke. Edibles take 2 hours or can take up to 2 hours to take effect. Is there fact acting kind of edibles? I'm not aware of any. I do know that if you want something to act faster, there are sublingual drops. Potentially, you could take a look at patches. What's your thoughts?
I was going to say the same. I would go with the sublingual drops personally, just because usually you can get those to kick in pretty quickly. That is one thing I like about the Theragels too. Usually they kick in for me in under an hour, about 45 minutes. So that could be an option as well, because that bovine casing does kind of work with your tummy to break everything down. So I would work with one of the two of those personally. However, if you're experiencing maybe more of pain related, you could go, well, it's asthmatic, but if you were experiencing more of a pain, you could go that topical route.
Sure. That's good. Yeah. So, I'm not aware of an edible. Again, this depends on your body. Every person's body is different. Some people take 2 hours to metabolize the edibles. Some people can do it in 30 minutes. But I don't think there's any fast acting versions of it. I know there's nano products that work a little bit faster, but I think you still need to pay attention to the fact that edibles take a while to work. They're not going to work in like vape pens work almost immediately, and tinctures work usually within 20 minutes. You're not going to find an edible that's going to be working that quickly. Let's go to the next one. It says, I am presently using Soothe, Calm, and Dream. Do I really need all three products? I think I want to address this from two different angles. I think first angle is, as I mentioned, I have a regime. When I wake up in the morning, like I have herniated discs in my neck, I have 7 of them. And if you want to talk about pain, that's it. And I can wake up sometimes with a level of pain of a 7 or an 8. Now, I use a vape pen when I wake up in the morning. And the reason for that is because it immediately takes my level of pain down from a 7 or an 8 down to a 1. And when that happens, it's just, for me, it's remarkable. I'm always amazed, even this morning when it happens. Now, then I take some lingual drops. I know that they're going to take about 20 minutes to work, but they'll last and they'll take me into the early afternoon. Then early afternoon, I have another product that I take that helps me take me through the afternoons, get me into the evening. And then right around dinner time, just after dinner, I have another product that I take. So every 4 hours, 4 to 6 hours, I have a product that I take to cover that particular period. And then, as I mentioned, I'm the chocoholic before I go to bed. So I think one way of answering this is you need to have coverage, and you need to match your products to the coverage. I use 4 different kinds of products. Actually, I have 5 different kinds of products sometimes, depending on the day and whether I'm working out or not. So I think your regime, making sure that you're covered during the day, especially if you have a condition like I have, which is like herniated discs that are not going to go away, you really got to make sure you're covering. I think that's one way of answering that question. But I think I'll let you talk about it from the product side, because there's another way of looking at it as well.
Definitely. I think you really said and hit most of the points. Every day your body is a little bit different. You're a little bit different. You might need something else. I do personally, like you said, I have different things I use throughout the day, and they're for different needs. So for example, I take Calm every morning, actually. It's the first thing I do when I wake up in the morning. I get that, all that anti-inflammatory goodness. I wake up, my neck no longer hurts, my back's feeling a little better. But I don't use Calm throughout the day. I have other things that I then go to. So I think it would be really important to just kind of address what you use each product for and how you're using it, and making sure that it's matching your regime. If it's not, or it's not as effective as you want it to be, then maybe we could kind of tailor from there. But I would probably keep all of these products, use that Calm throughout the day, get that Soothe in the afternoon to lift you back up after a long day, and that Dream just to get you to sleep at night.
Yeah, I think when you say, do you need, the answer to your question is you need to be able to come up with a regime that covers you during the day. And I think there are different products that give you different levels of calmness, energy, and relaxation that I think that these particular products really bring to the table. So I think it's really your choice. You could cut down, I guess, to 2, but why not use 3 and really make your life better? Put it that way. One question is, what's the difference between Delta 9 and Delta 8? Rosa, you've never heard this question, have you?
I haven't. I'm not as familiar with Delta with the two. I do know that I believe it's the Delta 8's a derivative of like a CBD in the plant that then grows and is kind of has that same psycho effect.
Yeah, the Delta difference between Delta 8 and Delta 9, it looks very, let's just say it looks very similar with respect to the molecular structure. However, Delta 8 is not as strong and frankly is not really as effective as Delta 9. Now, what you'll find is that Delta 9 is typically something that is found in higher quantities, like in cannabis. Hemp is defined to be a product with 0.3% THC or Delta 9 or less. And Delta 8 really is something that is low, let's just say, is not really in that particular mix when they take a look at coming up with that particular formulation. Now, I do want to point out that Delta 8 is not as effective. It's about 50% as effective. It does address the CB1 and CB2 receptors, just like Delta 9 does, but it just isn't as effective. And I think the biggest problem is it's produced in very low quantities. And so by being produced in very low quantities, a lot of folks that are making medical marijuana products really don't go out of the way to make Delta 8 products because the Delta 8 is in the product already. It's already there. You don't necessarily have to make a specific Delta 8 product. I know there was a craze of people going out buying these Delta 8 products, and the CBD vendors really took advantage of it. They actually formulated products that were very high in Delta 8. Now, caution, CBD is not a product that's regulated in the market. Here in Florida, for example, we have laws and regulations on Delta 8 and on Delta 9 because it's a cannabis-based product. There are very few regulations and testing being done for Delta 8. Find out if the product that you're looking at, if Delta 8 does have a certificate of analysis, and find out if it's done by a quality lab. Surterra is required to do 2 tests themselves in-house and a 3rd test from a third-party manufacturer to be able to make sure that the product is safe, and that's how it gets certified by the state of Florida. There are only 2 vendors that I know that do that kind of certification and do that looking into Delta 8 products. So there's a lot of products that are what I call questionable out there in the market. And that's why I'm not a big fan of Delta 8 products. Now, you ask a question, the real question is with regards to high blood pressure and rapid heartbeat, the Delta 8s and Delta 9s will cause your heart to race, will cause higher blood pressure. But I think you have to be careful of taking it in lower quantities when you do that. If you have a heart condition, your doctor and your medical marijuana doctor will work together to readjust both your heart medication as well as your medical marijuana medication to really work together. And I have a number of patients that do that. They have heart conditions and they use medical marijuana very effectively. But there has to be an adjustment in the quantity of both heart medication and also the medical marijuana that you're using. If you are experiencing a racing heart and you're experiencing blood pressure problems, please consult your medical marijuana doctor and also your doctor. Your medical marijuana doctor can probably help you. The person you got your card from will probably be able to help you address this issue, and it'll be doing that by changing your regime and the types of products that you're using. I hope that answers that question. Now, does it matter if you have sleep apnea when taking cannabis for sleep? Actually, Dr. Greg actually helped answer that question. And the answer is sleep apnea is something that is caused by restrictions in your sinus canals. And so generally, sleep apnea isn't really affected by medical cannabis, but you have to be careful when you're doing this. In other words, what you want to do is make sure you use like a sativa type product to really help more energize your body. But if you have sleep apnea, you can use medical cannabis. It will help you. It would probably be best to take a sativa type product to really help you that's out there. And then also make sure that you're letting your doctor know, if you're working with a doctor, let him know that you're taking cannabis so that they can make sure that there's appropriate adjustments are being made to your sleep apnea routine that's out there. So I hope that answers that question. Hope to get that one. Cool. I think there you go. There's the answer that Dr. Holt gave. Can I combine medical marijuana with melatonin? There's again, Dr. Holt has answered that particular question for us. although melatonin is relatively safe, it does show that it can be effective. It can be more effective in higher doses. I'm one who always says you got to be very, very careful of taking more of a particular product. And I agree with Dr. Holt saying try to find out what the underlying condition is for that insomnia, because sometimes by taking more, you're not necessarily you're addressing the symptom and not necessarily addressing the problem. And that's going to be very important. So I would say, if you're asking, can you combine melatonin with medical marijuana? Yes. And the answer is there are products out there that have melatonin, and for example, hemp products or medical marijuana products that have melatonin in it. But again, I would say you take a look at using it in low doses, and then also make sure you understand or try to figure out what's causing the insomnia. Because if it's something like pain, by addressing the pain, it'll also be able to help you get back to sleep. So, cool. I always forget what type to use for calming me down at bedtime. I don't know the difference between them all. I keep forgetting. Rosa, tell us about indicas and sativas, indica and sativa leaning products.
Leaning products. Well, one thing and one easy way to remember is indica in the couch. So you are going to be relaxed, you're going to be sleepy, you're going to be probably getting to bed. And so typically your sativas, I like to tell guests, sunshine sativas, you're going to be up, you're going to be moving, you're going to be happy. So those are the easiest two ways I seem to help people be able to remember the difference between the two. But of course, having your own indicators, having a little journal where you write which medicine you're using and for what is always going to be one of the best things to do.
Sure, that's there. So let's see, what's the next question we have here? What's the best product or strain to use at night to relieve back pain and to enhance sleep quality? Rosa, I think you have some answers to that.
Definitely. I would probably use the Dream products personally. It does depend, of course, what kind of back pain you're experiencing. If it is something with the spine and a little more nerve pain based, you are going to want that higher THC. But if maybe you've just had a long day and you're having a lot of muscle pain, maybe moving back to something like a Soothe product where it will give you that psychoactivity, but also get that body pain down will be more effective for you.
And you used a very important word called best. Best really depends on you. Every person's body is different. I mean, it's just like alcohol and it's just like caffeine. Some people in alcohol can have one drink and they're done for the night, and some people can drink the whole bottle and candidly, they're just getting going. It really depends on what's best for you. It's hard to be able to, this is not a process where we say, take 2 pills and call me in the morning. To go low and go slow is to really find out what your tolerance is to THC. And then once you do that, what you're doing is you're then finding out how much CBD you can put in there to be able to really dial in and really target the particular condition that you have. And it may take a week or two, maybe a month to really get it done. But your body will tell you when you go through that process and you begin to feel better every day, take a little bit more and you begin to feel every day, a little bit better every day, you feel a little bit better. You'll know, your body will tell you. You don't need a doctor to tell you, your body will tell you. And the body will also tell you when you've taken a little bit too much, you get a little anxious and it doesn't work as well. I know there's some questions that came in of people taking more. More is not necessarily better. Sometimes you need to dial that back to get to the right level for your body that really helps you dial into that particular product. So I'd say also pay attention to the dosing, because best is a function of what works for you. There is no black and white answer. And candidly, in having discussions with a lot of medical doctors, they'll tell you the same thing. It's really depending on the patient themselves. How do I know that terpenes work with my chemistry to get the best experience? I use edibles. Indica before bed keeps me awake. I think there's 2 ways of answering that question. I'm going to have you help me here, Rosa. First of all, you'll know terpenes work because you'll feel it. Again, it goes back to this whole dosing thing. You'll know when you begin to feel better. And again, if you have, for example, if you're looking at sleep, and we can send you in the direction of some terpenes that work in that area, by trying them, you'll know what works and what doesn't work for you. Now, in the case of edibles, there's a lot of edibles on the market, and a lot of edibles do not have any terpenes in them and do not have any CBD in it. Is that correct? I mean, I know that Surterra is not the case, but there's a lot of products on the market that are that way. That's safe to say?
That is definitely safe to say. I do find too that with people, the more THC you take, it does tend to make you sleepier. So for some people, that's things like our dark chocolate don't have any terpenes that are reintroduced into it, but it does have the THC, and that does help most people get to sleep.
Sure. And I think that's really important, is that the terpenes will help you. but make sure that you have terpenes that address it. It's not a matter of indica or sativa. It's more of a matter of, as Forrest pointed out earlier, the matter of the terpene profile. It says, I know that strains and terpenes have a different effect on each person, but historically, what are the best terpenes for sleep? I think we just went over that, but Rosa, you want to mention those again?
Yeah, absolutely. So some of my favorites were going to be that caryophyllene, all that anti-inflammatory properties in there. Myrcene, it's going to be nice and heavy in the body, very relaxing and pain relieving. We have the linalool, which I personally adore for sleep. I think it feels like a cup of chamomile tea. Which, funny enough, bisabolo is something that is found in chamomile tea. So that's one.
Yeah, there you go.
Is regulated and happy. Those are my favorites, I would say, personally.
Okay. Well, again, and this is really something we're kind of pointing you in the direction of a lot of products that are here. Caryophyllene, myrcene, linalool are all, they're kind of fan favorites, limonene as well. So please take a look at terpene profile. And again, that's very, very important. If you have a product like a gummy and it doesn't have any terpenes in it, probably not going to help you very much for sleep. It'll help because of the THC level, but it's not going to really truly address what the insomnia that you may be trying to address. It says, does your body require higher and higher doses in order to get its therapeutic sleep needed? I personally, from a medical cannabis standpoint, the answer is no. Once you find your therapeutic level, higher doses aren't going to really help you very much. But also, I think Dr. Holt has also commented that if you're taking medication, again, for sleep, it can, when you take medical cannabis, what happens is that medical cannabis starts to work with not only your body, but it'll also bind with the receptors in your body. And what happens is that over time, high doses of medication will lead to a downgrading of your receptors. In other words, it'll downgrade the receptors. So in this particular case, more is not better. I recommend in the area of cannabis, and if you can see here that Dr. Holt is also recommending something called a holiday, where you actually take a day or two off from using cannabis. Rosa, you want to address a holiday?
Absolutely. I think they're the best. I do tell patients a lot of times, especially because I do find a lot of them have been using for so many years and maybe didn't have perfect medical cannabis so that they knew exactly what they were doing. So 48 hours is known to be something that will kind of reset your tolerance. A lot of people in the industry call it a tea break because you're taking a break from the THC and the terpenes. And I've noticed that at least for me personally, when I do take a tea break, I come back and everything just feels more effective. I'm using a little bit less, my endocannabinoid system lights up more, and it's a great way to keep your dose at a place that you enjoy. I think they're really effective.
Yeah, I think what happens is your body gets used to, especially if you're bringing an outside agent in to help it, whether that's a pharma drug or it's medical cannabis, your body will start seeing that this is coming into your body. It'll get used to it coming into your body. And what happens is your body gets lazy. It stops producing the endocannabinoids, for example, that's needed to help you address sleep. By taking that holiday, your body kind of wakes up and says, gee, I'm not getting a little help from the outside. I got to do the work I'm supposed to do. And it causes your body to kick back in. And I, for the same reason, I found that after the holiday, I use less medical cannabis product, and I found it's a little more effective. Now, what is a holiday? Every 4 to 6 weeks, I'll try to, it's supposed to, they tell you to try to take 4 days off. In my particular case, with the herniated discs in my neck, I'll get maybe a day and a half, and then my neck taps my shoulder and says, if you don't do something pretty quickly, I'm going to let you know I'm here. So a holiday can be as short as a day, but it's important that you go through it to be able to help your body, what I call reset. It's like hitting a reset button on your body. That's safe to say, Rosa?
Definitely.
Great. There's for minors with a medical card for insomnia and anxiety, what is the recommended dosage? Again, you can't really recommend dosing with medical cannabis. You really have to, especially with minors, go low and go slow and find out what works most effectively for them. I will say that in many cases, minors actually need or require a little bit more dosing, a little bit more of a dosage than adults sometimes to be able to address their particular case. Now, Greg also pointed out something that's really important, and that is that if the underlying factors you find out what the underlying factors are for causing the insomnia as well. He's a sleep specialist, and I agree with him. If you're having pain, if you have inflammation, taking more sleep medication really isn't solving the problem. By being able to lower that inflammation, by being able to lower that pain, lower that anxiety. I know a lot of people don't realize that children get anxious and stressed just like you do. So really try to figure out what these stressors are, what the pain levels are for the child, and it really can help you quite a bit. I know that's, again, I'm not answering the question on a recommended dosage. Again, the go low and go slow method is in place, but really pay attention to doing that, and then also paying attention to trying to find out if there is anything in the background that really is causing that particular problem. I have a couple of grandsons, and I found that reading them a story before going to bed, they go right to sleep. If we don't read a story and just say go to bed, we're wrestling for about the next hour. So there's also, again, that's one of the underlying things. I found there's different ways that you can get folks to really calm down. One other question is, how can I wean down from needing 500 milligrams of THC to stay asleep for 5 to 6 hours? I think it's not a matter of just the milligrams itself. It's also a matter of the route of administration. I think that an edible would probably be more effective than a tincture. What's your thoughts, Rosa?
I would agree. I think an edible would be really effective, especially because we're not sure what they're using the 50 milligrams of. It might be just a big, dose of rosin. It could be a concentrate. It could be kind of anything. But ultimately, I do feel like if you had some form of edible, that might get you to really relax down. I personally, too, I like to switch it up on myself sometimes, and I will go straight CBD. And so if I notice that the THC, I'm needing more, I'll go to those restorative properties from the CBD and kind of work backwards, get my body and my mind to relax down, and then go from there.
You brought up something that's really important. It's something that I heard a term called the THC train. There's a lot of people that hear about THC. They think that's the only answer. They think that cannabis is all about. And what they don't realize is that things like CBD, some of the other cannabinoids, can be more effective in addressing their particular condition that they're looking at. I would say, especially if you're taking 500 plus milligrams of THC, wean yourself off of that by increasing the amount of CBD that's there, and find out if there's some CBN in the product that you're using. Switch from using a tincture drop, which lasts 4 to 6 hours, to going to edibles, which will last for the night. Things like that can probably help you wean down from the THC. I would say that THC is masking really what some of the issues are. Greg pointed out something important. Find out what's really affecting this. Is there anxiety? Is there inflammation? Is there pain? Something else that's also affecting you that's there. I hope that answers that particular question, but I would say get off the THC train, get on the CBD train, and then figure out also some other routes of administration you'll find it a lot more effective. How do I dose to fall asleep and stay asleep? For example, if I use a tincture at bedtime, it seems to wear off after 4 hours. Right on. They're designed to last 4 to 6 hours. It lasted 4 to 6 hours. You got what you want from it. This is where using a gummy, which is supposed to last anywhere from 6 to 10 hours, comes into play. Rosa, your comments on this?
I would agree wholeheartedly. If the tincture oil is no longer really doing it for you, we've got to get something in there that's going to last a little bit longer. But also that layering effect, if you want, kind of have a vape pen ready for you by the bedside so that you can use that if it's still not something that's being effective.
Yeah, and vape pens work pretty effectively and pretty quickly. They'll work within 2 to 3 minutes, sometimes even faster. So again, you're not doing anything wrong. You use tinctures, which is the right thing to do. I made that mistake when I first started into cannabis. I was using some tincture drops and having trouble waking up in the middle of the night. And when I talked to when I learned more about medical cannabis and found out that edibles really lasted longer, of course, being a chocoholic, that was a very easy transition to that. It made a big difference in my life. Is there a difference in effects by taking 5 10 milligram indica tablets or 1 50 milligram tablet? It shouldn't, as long as you're using the same manufacturer. If you have the same product and same manufacturer, there shouldn't be any difference. Your thoughts, Rosa?
I wouldn't see any difference personally. I think it should all, exactly like you said, as long as it's the same person making it, then you should be good.
Yeah, that's there. Cool. I take 200 milligrams of indica gummy in order to get to sleep. Any suggestions on how I can mix with CBD and other strains? Rosa, you want to make a comment on that one?
Yes, definitely. We touched on it a little bit earlier, kind of doing that opposite where you start to lower your THC and raise a little bit of that CBD to find that perfect ratio for yourself. Especially with 200 milligrams, that is a pretty high, gummy that you're probably having to take. Some other things to address are, of course, in the body. Do you have a gallbladder? Does the edible help at all? Could you possibly not be having the enzyme that processes it? There's a couple of different things that could definitely be at play. But if you're upping that CBD, I think that really just slowly, maybe 5 or 10 milligrams at a time, where you're taking that throughout a month and switching your ratio, I think that will get you in a really lovely spot.
Right. So there's a question here about CBN. Is it beneficial for sleep? Since it's beneficial for sleep, is there a maximum time to age dry flower to increase the CBN content? I am not an expert on aging flower. Do you have any answers on that? Maybe Forrest or Rosa?
I am not as sure with flour. I'm so sorry.
I know there's an aging
I can
process.
chime in a little bit. I know that it'll have to do with the strain itself and the makeup of the strain itself. As you talked about, like different cultivars are coming together, so you're seeing things with different terpenes in them, different profiles and genetic makeups of them, and so it's really going to depend on the flower that it's essentially being bred with. That is what the makeup is of it. I wouldn't say that there's necessarily a minimum time to dry it to maximize it, though. It's going to depend on how much is in it naturally.
Yeah, I think it has to do with the strain. It has to do with the way it's being dried. It has to do with whether it's indoors, how it's being stored, that type of thing. There's a lot of factors involved in this. I don't think there's an exact formula that I'm aware of anyway. But there is a question here: is it harmful or ineffective to use cannabis after the expiration dates? I'll let you guys answer that one.
I don't personally think it would be harmful. It does start to degrade the quality of the product more than anything. So you do lose some of that efficacy.
Right. I think it's just not as effective. I don't think it's going to be harmful to you, but I just don't think it just won't work as well. That's all that's out there. What are the best terpenes to help turn off my active racing mind and allow me to sleep? Which Surterra products are the highest level for those terpenes? I have to tell you, I have an active mind. I'm an engineer, computer scientist by trade, and I love games and that type of thing. So I found that a lot of the products that you talked about, I think I'll let Rosa talk about this. A lot of the calm products that come into play really help quite a bit. And then also I found that paying attention to some of the terpenes like the linalols and also the limonene really help quite a bit. Your thoughts, Rosa?
Definitely. So I love that you mentioned the calm products, because I do think that the calm products, for me at least, are single-handedly what gets my mind and body to relax down, especially if I'm very anxious from a long day or a long week. Sometimes it'll compile. So I would say for me personally, some myrcene and linalool, those two, if they're in anything, usually my mind will calm down. For me, of course, everybody's a little bit different. I know the limonene actually does help their mind. It lifts them into a better mood, so then they don't get stuck in a spiral of bad thoughts or anything of that nature. So any of those three, I would probably say, are going to be the best for if you are struggling to get your mind to turn off.
Sure. Question is, what is the optimal level of THC to CBD combined for sleep? I don't know if there is an optimal level. Again, this goes back to you and what works for you. I would say start with go low and go slow. This is where this applies, because again, every person's body is going to be a little bit different. It really has to do with, it really is, as Greg points out, it really is individualized. It's there. Other question: can marijuana increase the risk of dementia like prescription sleep aids can? That is an excellent question, and I think the answer is yes. Marijuana has been linked to some brain-specific regions that can lead potentially to dementia. Now, that doesn't mean that using medical cannabis is going to give you dementia. In fact, if anything, medical cannabis has been shown to actually help diminish and to address dementia. It's just that if you're using sleep aids, like benzos. And over long-term use, it does lead to dementia. And the same thing, cannabis, it becomes a crutch rather than trying to figure out what the real issue is of why you're having trouble sleeping, and or if you take a look at, in the case of dementia, what is actually happening. Your medical marijuana doctor will help you with dementia. And again, it's been a lot of effective studies. One of them that just came out of Spain is very, very interesting about how they've really, really been good to address it. But I would say if you take a look at long-term use, potentially, by long-term use meaning 3 to 5 years. I think short-term use over the next year or so, I think you'll find it'll help quite a bit. And again, I've had some patients that have said it's really helped. It doesn't get rid of it, but it does slow it down. It's kind of like MS. It's the same kind of thing. Does marijuana have a long-term effect on your memory? That's always a good question. There's a lot of studies being going on to that. It is known that marijuana is linked to the brain. That's what THC is all about. And it is known that there are a lot of studies, especially with animals, about how effective that it really is there. Now, taking that holiday will help to reduce any of the negative effects that may be coming from cannabis with respect to the long-term effects on memory. I know that there's 2 interesting studies that I saw in the last 4 months. One of the questions that came up is why, when artists, whether they're musicians, whether they're stage artists or whatever, are they more effective with or without cannabis? And the answer is yes, because it's actually working on parts of your brain that bring out a lot of your creative processes. Now, will it negatively affect you? Really depends on the person. Unfortunately, it's very person dependent, but I would not necessarily not use medical cannabis worrying about your memory. I think if anything, we know that it does help would help you recall memory. I know pinene is a terpene that is very effective at bringing back short-term memory. It works very well, but you got to be very careful of if you have PTS, that may bring back some memories that you don't want. Do you have any comments on that, Rosa or Forrest?
With memory, it's very similar to what you said. Realistically, it's more short term. I've noticed that in the short term that I have memory issues, if I have any, but that long term use really can do a little bit of that. Holidays needed. I think the holiday ultimately is what kind of saves you from having any struggles with cannabis long-term use. Kind of making sure that your body is regulated and it's not becoming completely dependent on something else.
Cool. Okay, we're going to go to some of the live questions that came up. And Cheryl asked, does it help with sleep apnea? I know that it can. The answer to your question is yes. I know I have some relatives that have had sleep apnea. We've addressed them to medical cannabis and it's helped, but it's not a solution. Sleep apnea, as I mentioned, is something that really is a restriction of a lot of the canals in your brain, your sinus canals in your brain, in your body, your head, I should say. And so this is where a doctor, a sleep specialist like Greg comes into play that can help you with that. But medical cannabis can help you with sleep apnea. It helps to help you sleep better and sleep more relaxed. By sleeping more relaxed, it puts less pressure on your sinus cavities. Keith asked, what's the best CBD to THC combo? I know it's different for every person, but that again goes back to really going low and going slow. Is that safe to say, Rosa?
Absolutely. Unfortunately, there's not one size fits all. It is going to be completely your body. So starting maybe with a 1-to-1 and going either direction slowly would be probably one of the best things to do.
I know that one of the things that I've found, and then again, this is just working with a number of folks, but by increasing the amount of CBD to THC as a ratio has really made a big difference in helping with sleep and helping people relax. And that's kind of a golden rule, put it that way. Your comments, Rosa?
Oh, absolutely. I'd agree. CBD, I like to think of THC sometimes almost like a Band-Aid. It's fixing the immediate problem and taking care of what you need. But that CBD is that long term. It's like a vitamin. You use it long term. It works in the system. It helps best. So I personally do tend to like more of a CBD for nighttime, especially. Those CB2 receptors just throughout the body accepting everything really makes me nice and warm and fuzzy.
Sure. Now, Jen asked a great question about what is best for insomnia due to fibromyalgia. Well, what we've talked about this whole webinar, just the same processes apply whether you have fibromyalgia or not. And in fact, I would point out that CBD is known to have a neuroprotectant quality, which means it helps be able to. In fact, we're doing a webinar next week on neuropathy, and we're be talking about this. So please join us for that, because fibromyalgia fits into that category. But we also know that it is known to help with the neuroprotective quality. It doesn't get rid of it. It doesn't reverse it, but it helps to slow it down. And I think it's very, very effective to help. Using medical cannabis really helps insomnia, again, with fibromyalgia or any of the particular areas that have to do with neuropathic problems. Your comments on it?
I definitely like CBD for fibromyalgia personally. I think it's a little tougher to explain that it might be a little more long-term that it takes for it to become that neuroprotectant. But especially for sleep, when you can take care of that pain, you can get more effective sleep. So I would always recommend a CBD, a 1-to-1 if you need that immediate pain relief, just because fibro can be so extensive on the body. But a CBD is definitely what I would go for.
Right. Anonymous asked a great question, and we're going to be like broken records when it says, how much CBD should I take each day? Again, go low and go slow, but I don't think that you can hurt yourself by taking too much CBD. Let's put it that way. CBD will really help in a lot of different areas. We don't talk about it in this particular presentation, but we do know that CBD helps in a lot of different areas with a lot of different conditions. So my advice is go low and go slow, but really try it. I think that's the best way of putting it. I can't give you an exact answer because I don't know your body, but your body will tell you. You don't need me to answer it until your body will tell you. Stuart, you have a great question, and I can relate to this. Suffering from chronic insomnia for 25 years. I'm 64 years old, and I've been taking 10 milligrams of Ambien for the last 6 years. It doesn't work anymore for me. I tried 10 milligrams of temazepam with no luck. Is there specific ratios to try for sleeping? I have one of my patients, which is my mechanic. I'm into foreign cars, and so he hadn't slept well in 20 years. And when he found out I was in the medical cannabis business, he asked if I could help, and the answer to your question was yes. I ended up having him again get a card. We went low and go slow, and this may sound crazy, but what we found in his particular case, the Calm product helped him quite a bit. In other words, it wasn't just a matter of just throwing THC at it. It was a matter of just getting his whole body to relax. In fact, we started him on a program, and about 4 weeks after we started him on the program, he called me up and he said, I got to see you. I said, great. And we went to dinner, a very fancy place. He had to take me to a fancy place. I asked him why. He said it was the first time in 20 years he got 8 hours of sleep. And on top of that, he woke up, he said that the sheets weren't all over the place. He found that medical cannabis did work. So I think that really, when you talk about specific ratios, that go low and go slow will really help you quite a bit. Again, it works. It works much better than a lot of the pharma drugs, and there's a lot of studies that indicate that. Your thoughts on that, Rosa?
I agree. Honestly, cannabis has done so many wonders, and we've spoken quite a few times about how really getting to the bottom of the problem is ultimately what you want to do. And with that chronic insomnia, sometimes there's all that pain, and so you want to take care of that. And I'm so glad that the Calm worked for your friend. It's one of the reasons it's my number one that I recommend. Ultimately, it tends to be the one that really helps people unwind in the mind and body and get the job done.
Right. In fact, it was surprising to me that we found that Calm worked a lot better than Dream, which in his particular case, and it's his particular body that's there. But you're addressing something that when you say, especially pharma drugs, anything, the more you take, the more your body gets used to it, the more your body gets immune to it. And a lot of the doctors don't talk to you about taking a holiday. I can't stress more, try a holiday, because it will really work. And again, in my case, I can take a holiday. I do have pain I have to manage, but I'll get away with it for about a day, and it does make a big difference. I can feel the difference. Keith asked the questions. I have to change my dosing all the time. Why? And I'm going to kind of take this one on to start with. Rosa, I'll get you to chime in. But in my particular case, I had an auto accident that caused my herniated discs in my neck, and they were severe. I had my whole spine was inflamed. My body was inflamed. As my body inflammation went down, I needed less product. I needed less medical cannabis. In fact, I ended up finding out that I needed to use more CBD than THC because what I was doing by increasing the CBD was diminishing the amount of inflammation, which was diminishing the pain. So the answer is, as your body heals and as your body gets better, a lot of times readjusting for that really makes some sense. Rosa, have you ever seen that in your practice?
Absolutely. I have found that once people start to heal, they really do. They need less all around. I do recommend, of course, continuing to use a little bit of your medicine because you want to keep that dosing in your body. But once you start healing, you will notice a change. Something I also notice is that sometimes with patients, if you're not eating enough, the endocannabinoid system likes the fat. So that could be a reasoning if you're not eating throughout the day. But I do typically find that when someone is healing and healed, their body works better. They don't need as much.
Right. It's something to really pay attention to. Leah asked an excellent question, and that is, are medical marijuana vape pens as dangerous as nicotine vape pens? And the answer, frankly, is no. First of all, let me address, there were pens that were brought in. They were mainly CBD type pens that were brought in Southern California from a questionable manufacturer that, by the way, they couldn't even find who manufactured them when they went back and studied this. And they had oil in it that was dangerous. It would kill you, and it did kill people. But because CBD was unregulated, these pens were unregulated. Fortunately, they jumped on it pretty quickly and just stopped the sale of that particular product. But I want to mention that if you purchase a product, first of all, from a certified dispensary, like, for example, Florida certified dispensary like Surterra, it has been tested and it will not be dangerous. Now, key to vape pens is when you have a nicotine-based pen, it burns the tobacco, creating the carcinogens. When you have a vape pen, you're not burning anything. What you're doing is you're actually heating it. It's almost like you're steaming the flower. And by doing that, what it's doing is producing a vapor, but that vapor it has much less tendency to be carcinogenic. There's some people that say there aren't any carcinogens in marijuana. I tend to look, as a practitioner, anytime you put something into your lungs and anytime you're burning something, you do have to be careful of it. Although we do know that from the standpoint of, we've used inhalation devices for years in the pharma world to be able to address things like people who have lung problems. Same thing happens with cannabis. It can be used effectively on a positive basis, and cannabis is really known to be able to be in the positive, not the negative side. But nicotine pens are burning, vape pens are not. And that's primarily the main difference. And because of that, they're a lot safer to use. And I find that they're not going to cause the negative side effect that you see that's out there. Again, if you purchase from a responsible, tested, licensed dispensary, you won't have a problem. And I think it's good to ask that question because we need more regulation, especially in the CBD world, to be able to make sure that we have safe products. Last question. Well, it's not a question. It's a comment about using cannabis for sleep and traveling. Traveling. That's a good question. When you travel and you get in the air, and the minute you hit the TSA is federal space. And technically, if you travel in the federal space, you can't bring your cannabis with you. Now, the TSA will tell you they're not looking for cannabis. In fact, they are not. They're looking for guns, explosives, and that type of thing. But if you throw your vape pen on that tray, they've got to do something. So just don't bring it with you. Now, what do? When my family lives in California, I typically use the product before I get on the plane. And then I typically, on the other side of the coin, will actually buy products when I get there. So I be able to use products on the other side. I have no dispensaries that are there, and being able to pick products up that are out there. So I would say just make sure that you have on the other side, when you get to where you're going, a place to be able to pick up the products that you're using and be able to use it that way. And I hope, again, if you're using it for anxiety, candidly, using a proper gummy or an edible will help you during the flight. And then afterwards, you can be able to address it once you get there. And I hope that answers the question. Do you have any comments on that, Rosa?
I think you covered that very well. I try to remind everyone that traveling with your cannabis is not a great idea because of the federal legality there.
Right. Hopefully someday that'll go away. But, with alcohol, you really can't carry it anywhere and have open bottles. So, I mean, we're still going to be facing rules and regulations like that. Will Surterra ever end up carrying a Dream CBN product? You know, I don't know if it's really even needed. I think the Dream product is so great. I don't know. Forrest, I'll let you take that one up.
Sure. I would say no, not on the immediate horizon. We're not looking at it. As you said, Dream definitely works very well, but this says ever end up. And I will say that we are paying attention to CBN, and the more that it's getting studied, it may start to come out in some other products that we have. So just be on the lookout for it, but not in the immediate future.
Yeah. Okay. So why does it change from CBD to THC different when I go to dispensary and the same name products change from CBD to THC percentages? Why? I'm trying to figure out what that question is. Okay. I haven't quite figured it out. I do know that where are ratioed products where you want to have more CBD in the product versus THC, or vice versa. You may need more THC than CBD. I had a knee replacement and had to address pain. And so I wanted a higher THC product, the CBD product during the day to be able to address it as I was recovering especially the first 8 weeks to 10 weeks after I had my surgery. So I think the reason that there's ratios that are there is to be able to fine tune the product for your particular application. I think that's what we're really addressing. Is that do you see any other way of reading that question, Rosa?
So I was thinking maybe they're asking about why when you go to the different dispensaries, the CBD and THC content can be different. And really, when you go to the same dispensary, it can be different. And that's the harvest, your batches. Everything can affect cannabis and how it grows, especially if you're doing something like your greenhouse or your outdoor grow versus your indoor grow, where you can carry a little bit more. We try to aim for consistency ultimately, but with a flower product, it really is up to the product, the flower, and how it grows.
Well, and I think you brought out a good point. Cannabis is botanical, and anything that's made and anything that's grown will have differences in the product based on temperature, time of year, day, indoor, outdoor, that type of thing. And so that's why you see a little bit of a difference in each product. Not major, but there will be some differences that are there.
And the other thing I would actually add to that too is that, again, because there's a lot of genetics going on with different cultivars and whatnot. And so as you start to bring multiple strains together, they start to end up with different profiles. And then add on the fact that you're talking about a plant that has different conditions and the way that it's grown. There's a lot of variables that could play into it.
Cool. That's good. Good comment. Good. Let's see. Okay. D'Angela has narcolepsy, and I've been using CBD gummies for a while, and I've noticed that I'm becoming more immune to them as time goes on. I started to take 2 gummies, and I've had to increase them pretty consistently. Currently, I'm taking that as a combo with Delta 8, Delta 9, Delta 10. Ooh, Delta 10. Be careful. I also take products like live resin. Any suggestions? Should I get my medical card instead? Absolutely get your card and get some professionals to help you. And Angela, the first thing you do is get a card and then go call Surterra and you do consultations. You want to comment on that for a minute? I mean, we'll answer your question, but we didn't bring up the fact that you can get a consultation from Surterra, which I think is very important. Rosa, you want to comment on that?
Definitely. Consultations are one of my favorite things. So really, we usually use them to introduce people to cannabis. We get a lot of people that have never looked at the plant, never touched anything, and at most maybe know some reefer madness. So it really is about educating people. We will start you with any question that you have, getting really to know what's going on with your body, what's going on ailment wise, and what effects you want. From there, we can kind of give some education based off your terpenes, based off the endocannabinoid system, teaching you what THC does, what CBD might do, and curating a health plan for you. It's not always going to be perfect or exact. That's where that dosing, we're going to start low, slow. And I always suggest a journal, making sure you're writing down everything from your dosing to how it affected you, how long it lasted in the system, when did it kick in? Because you are going to want to have to find that sweet spot. And in the consults, I do have people come back. I ask them to bring their journals with them so that we can go over it and we can see where we maybe need to tailor and tweak things so that you're getting the most benefit out of your medicine.
Sure, it can help quite a bit. Now, the other thing that you have going on here is something that's interesting, and that's routes of administration. When you're taking the gummies, again, you're getting that 6 to 10 hours of coverage. When you're using the extracts, I'm assuming that that's a tincture, you're getting 4 to 6 hours. You're also mixing the regimes that's there. And I would say stick to a product that pay attention rather than worrying about the Delta 8, Delta 9s, Delta 10s. And by the way, stay away from Delta 10. I would say stay away from Delta 8 too, as a pure product. Okay. If it's in the product, great. As a pure product, be very, very careful. But I think that also pay attention to your route of administration and make sure that I would say in this particular case, get some consultations and really pay attention to the terpene profiles. That'll probably do more for you than trying to go out and experiment with a whole bunch of products that may not be addressing your particular situation. Your comments about that, Rosa?
Definitely. Come in. I think when you get to have someone who has a little bit more knowledge in cannabis, and then you can bring everything that you want and what effects you're looking for and tell us exactly kind of how to curate what your experience needs to be, we can work on that. It is a little bit tougher when you're buying stuff that isn't in a dispensary and you're not working with any professionals, because you might not get, as you said, like your COAs. Those are so important to make sure that things look good, and your dispensaries are almost always going to have those. And just the product, the quality of the product that you're getting. There's a lot of things that were on the market, might still be on the market, that are just questionable. But if you have someone that's there to really help you hold your hand through everything and educate you, then you can navigate the field a little better.
And stay to tested products. I know you mentioned using live rosin. I love rosin and resin products. They're my favorites. But I have to say, get it from a quality dispensary that really can help you quite a bit. I hope that helps. It says, okay, what terpenes are best to use for anti-inflammatory? I think this falls in your category, Rosa.
Yeah, I caryophyllene. That's always my answer, at least for that guy. I've noticed it the most in all of our pain relieving medication. It tends to be the one that really helps people unwind, and it lifts your mood up. So I always personally recommend caryophyllene for a lot of people. It is a little peppery though, so I do warn people that there might be a little tickle depending on how you use the product.
Sure. Good call. Good call. Now, Keith asked a question that says, can change in product and amounts of THC be a holiday? Because I change products, I feel it different, and then I go back to the old product. The answer is a holiday is a holiday. Holiday means stop using it, okay? Changing products is not stopping to use it. All you're doing is just changing the profile of product that's being presented to your body. And that may not necessarily address everything that you want to have addressed. I think, first of all, take a holiday. I think you'll find that it'll help you quite a bit. Take at least a day. And like I say, a lot of practitioners will recommend up to 4 days. 2 to 3 days is probably the most effective. And then if you're going to change products, try the new product, but stick with the product for, a week, maybe more. Give it time to work. If it doesn't work, go back to the old product. But I'm saying that pay attention to the profile, the terpene profile, pay attention to the ratios and the type of product that's there. Your thoughts, Rosa?
Take the holiday. Definitely. You can trick, your body a little bit with switching the terpenes around, but ultimately it's invaluable when you take a holiday. Your body really accepts the medicine almost in a different way, it feels like. It's like when you first started.
Right. William brought up a good point. I did mention limonene for sleep, and I didn't necessarily mean that limonene is going to be the primary terpene that's in the product itself. It is part of the terpene mix, probably a secondary terpene. It is in a lot of sativas, and the sativas aren't necessarily, they're energizing. They're not, sativa leaning products are energizing. You really want an indica leaning product. So what you want to do is you want to try to identify the terpenes that you have. I know limonene, one of the things limonene does is help the other terpenes work. So it's actually good to have. But I think if it's the primary product, you're right. I don't think it's going to be the best thing for sleep, but having it in the mix will definitely help with sleep. Your thoughts, Rosa?
Definitely. So I've noticed actually a lot of times when you see a heavy myrcene product, you're also going to see that limonene kind of backing it up.
Right.
So I do think that while for some people limonene is very active in the mind and maybe something that is it found typically in those sativas, like you said, because it helps the terpenes, it's really going to be about how the rest of that terpene profile is set up and how your body accepts it. So that could be different for every single person.
Great. Well, listen, that's the last question. And I want to thank everybody. But before goes away. Forrest, you had a little bit of a surprise for us. Why don't you tell us what you want to do?
I do have a surprise. We'd actually like to give away a $25 credit. So we've been talking about a lot of stuff tonight. So the first thing is, in order to get this credit, you will need to have our app downloaded and push notifications enabled, because that's how we're going to deliver this coupon to you. But we're going to deliver you a $25 coupon that you can use on any cannabis product. And to do that, I'd like the first person that can chime into the chat here and give us Rosa's 3 top terps. She's listed a couple of things tonight of the top things that she recommends for sleep. So if you can give us the first person to give us the top 3 of them in the chat, I will follow up with you and get your email, and we'd like to award you a $25 credit.
Cool. So this is one where you don't need the app to answer the question. What we'd like you to do is put in the chat the 3 terpenes that Rosa mentioned, and to qualify for your giveaway. And by the way, Forrest, thank you very much. This was a bit of a surprise, and a pleasant surprise that's out there. So if any of you have caught this, let us know. William is answering it, so I'll let you take it from here. First of all, I want to thank everyone for joining us tonight. I know this seminar has gone a long time. It's gone almost 2 hours, an hour and 50 minutes. Hopefully you've got some information that can really help you. I know this is an important topic, and it's something that's really, really important. People ask me why I do this, and the answer is I do this because if I can just help one person get their life back, have one person just get the relief, then this is worth it. And I hope that this has helped you. It's something that information is always something that really leads to solutions, and I think this is where we're really headed. And I want to thank everybody for taking the time and asking the questions. You'll be getting, as a follow-up to this video and this webinar, you'll be getting an email that'll give you a link to the video on YouTube, give you a copy of the presentation, all the resources that are there, Rosa's recommendations that are out there, and the weekly specials from Surterra. But I want to thank everybody for joining us. Before we sign off, Forrest, any comments?
Yeah, I would say it's very personalized to everybody. So make sure you really understand your root cause and what's actually keeping you up at night, because just taking a blanket approach to it is probably not going to help. So you may need to layer on different things to keep you asleep throughout the night and address each of those different things. So keep a journal, keep track of it, and really try and address those root causes to get a win here.
That's good advice. Rosa, your comments?
Yes. Well, of course, trust the process. That's a big one. I think a lot of people are a little bit nervous with sleep. They want it to immediately happen, but going low, going slow, finding that perfect combination for you will be invaluable. Ultimately, getting more sleep is the basis to just a healthy life. And so I think it's really important. I love what Forrest said. Please keep a journal, write everything down, so that way you're knowing what's going on with your medicine. And when you're addressing what your needs, you can come to us and we can just help you there. Right.
Yeah. And again, your body will tell you. One thing that's really important is, and that applies not only to cannabis, it applies to pharma drugs. Your body will tell you what's working, and it'll tell you what's not working. I think with cannabis, though, you're in control. I want to thank everybody for joining us. I want to mention that next week we have a webinar on neuropathy. That's a very important topic, and when we have an excellent doctor who's going to help us with this, Dr. Terrell Newton, is going to join us. And so please join us before and ask questions prior and during. It's there. I want to thank Surterra for joining us, for helping us and sponsoring and answering the questions. Great job. And I want to mention in the background, you've probably seen Lee and Leah, our commentators. Without them, this wouldn't happen. And I want to give a special shout out to thank them, and also the person who came up with the idea of doing this, which was Alyssa Katera. Without her, this whole thing wouldn't have started. She's that spark that really made it all happen. So listen, thank you everybody for joining us. Please join us next week. And if you're looking for a sleep product, please go visit Surterra. Good evening.